Blood gases are a quantification of the oxygen and carbon dioxide present in the blood, spoken about in the previous lecture. In this lecture, it will explain about blood gases. Oxygen and carbon dioxide are gases present in the blood, and the oxygen contained in arterial blood fluid is called arterial blood oxygen, partial pressure PaO2, and similarly carbon dioxide is called arterial blood carbon dioxide partial pressure PaCO2. What is the state of this partial pressure? Partial pressure refers to the pressure of each component present in the entire atmosphere. For example, nitrogen is 78.1% of the total atmosphere. Since blood pressure is 760 mm of mercury at 1 atmosphere, the partial pressure of nitrogen, which is 78.1% of the total pressure, is approximately 590 mm of mercury. Oxygen is 20.93% present in the atmosphere, so it would be present at about 160 mm of mercury. Now back to blood gases. Blood gases are mainly used to evaluate arterial blood oxygen partial pressure, arterial blood carbon dioxide partial pressure, and acid-base equilibrium. Normal values for PaO2 are 80 to 100 mm of mercury, PaCO2 is 40 ± 5 mm of mercury, and pH is 7.40 ± 0.05. So what is the state of arterial partial pressure of oxygen when it reaches 100 mm of mercury? Normally, the pressure is subjected to a force that tries to equalize. The barrier between the alveoli and the blood vessels is so thin that there is almost no resistance, resulting in an equilibrium state of uniform pressure. So, PaO2 of 100 mm of mercury in the blood means that the alveoli are in equilibrium with the gas containing 100 mm of mercury of O2. However, if the disease causes alveolar hypoventilation, right-left shunting, diffusion disorders, or unequal ventilation and blood flow, equilibrium cannot be maintained. As a result, PaO2 falls below normal. This condition is called hypoxemia. The property of pressure to move from a higher to a lower equilibrium state may be represented by the image of a waterfall. The partial pressure of oxygen at the uppermost atmospheric pressure is 160 mm of mercury. As it moves into the airways, the pressure is lower by the amount of humidity. Since the oxygen partial pressure in the body is lower than atmospheric pressure, the equilibrium state is about 100 mm of mercury while moving further into the alveoli. Then, depending on the partial pressure of oxygen in the blood, the equilibrium state of the partial pressure of oxygen in the alveoli and in the blood is 80 to 100 mm of mercury. As it circulates through the body, the pressure moves further into the cells, where the partial pressure of oxygen is even lower. So that by the time it returns to the lungs, the pressure is reduced to 40 mm of mercury. By the time the gases inhaled from the atmosphere reach the lungs, they contain moisture and the oxygen and nitrogen partial pressures decrease slightly. Once it reaches the alveoli, the oxygen and carbon dioxide partial pressures change due to the effect of carbon dioxide produced and oxygen consumed. Atmospheric pressure decreases with altitude. For example, at 2,000 meters above sea level, the atmospheric pressure is 596 mm of mercury and the partial pressure of oxygen drops to 115 mm of mercury, so PaO2 is 70 mm of mercury. Although the plane is flying at a higher altitude, the cabin pressure is controlled to remain around 600 to 650 mm of mercury, so PaO2 only drops to about 75 mm of mercury. As the partial pressure of oxygen decreases, the percentage of hemoglobin associated with oxygen decreases. And we can see that after a certain point, the percentage of hemoglobin decreases rapidly. Normally, PaO2 is 100 mm of mercury and SpO2 is about 98%. The details will be explained when we talk about hypoxemia, but this point of rapid change is the criterion for starting oxygen therapy. Since carbon dioxide is virtually non-existent in the atmosphere, it is only affected by alveolar ventilation, not by the environment or gas exchange. If there is not enough ventilation, it is stored in the body conversely, If there is too much ventilation, it is released from the body in excess. In the previous chapter, we described carbon dioxide as being like an exhaust gas, but that does not mean that you should exhaust it all out of your body. This is because the body maintains a balance between acidity and base, fluctuating from time to time, while trying to maintain a neutral level. This is called pH adjustment, and carbon dioxide and the bicarbonate ion, HCO3-, have a significant effect on acidity and basicity. Carbon dioxide, which affects acidity, is regulated by the lungs, while HCO3-, which affects basicity, is regulated by the kidneys to keep the pH level close to 7.4. The relationship between carbon dioxide, bicarbonate ion, and pH can be expressed by the Henderson-Hasselbalch equation. Bicarbonate ion is a metabolic factor and carbon dioxide is a respiratory factor, which is an indicator of its effect on pH. Thus, since carbon dioxide affects pH, its elimination from the body reduces the acidic component and results in alkalosis, which leans toward a base. However, if the kidneys are working properly, the renal compensatory action that excretes bicarbonate ions and balances the pH to neutral works to bring it closer to neutral. Finally, we would like to wrap up this session on blood gases by confirming the normal values. Note that normal values are based on the values shown on the slide. But they change with height and age, and for more rigorous evaluation, it is necessary to predict normal values by taking gender into account. Then, normality-abnormality must be determined.